Hello, I'm Dr. Vincent Placa and I'm Associate Professor of Public Health and Policy at the University of Greenwich in London. And I'm presenting the keynote speech and presentation for the SSHRA Third International Conference on Business, Economics, Law, Language and Psychology. So thank you for viewing this. The topic of the presentation is going to be social sciences perspectives in global public health. So just briefly, I'm going to do a brief introduction on social sciences and global public health and the coming together of both disciplines. And then I'm going to look at some of the more significant shifts and perspectives as a result of the coming together of social sciences and global public health, and then do a brief conclusion. And at the end, there are some slides with some references for you to look at if you want to look into this in a little bit more depth and detail after the presentation. So I'd like you to just think about or begin to think about what you see as the relationship between social sciences and global public health. So traditionally, public health and global public health, which is largely around health promotion and health protection and collective public health for societies, has historically and traditionally been seen through a biomedical orientation. So, for example, global public health and public health generally have been seen as being more to do with, for example, biomedicine, biology, for example, physiology, and we haven't taken a broader sociological perspective to, for example, why specific people become ill, why specific social groups are more likely to experience more chronic conditions, for example, or why specific people and specific groups are more likely to die earlier than other groups. So we've traditionally taken this biomedical approach, and we've been less social scientific about it. Now, as you probably know, the social sciences emphasises the role of society on health and illness. So we're looking at social determinants, societies, subjective states, relationships between social structures, for example, and individuals and lifestyles. And recently, within studies of global public health, there's been this shift towards looking at sociology and the social and behavioural sciences, as opposed to just the biomedical approach. And this has led us to look at, for example, health inequalities, social and economic health inequalities, and how societies create those health inequalities, how societies and economies socially structure and pattern health inequalities. That gets us away from the biomedical and the purely physiological approach, as you can see. Structural violence, how does war and violence in society, for example, impact upon global public health, health and well-being? And there's also been a shift because of this to looking at, for example, the impact of global processes upon health and well-being. So we need to look at globalization as a social process and its impact upon health, well-being and illness. So what I'm arguing for is that, yes, traditionally, global public health and global public health studies has been perceived as more traditionally biomedical, but the social sciences are now beginning to encroach upon those studies and embrace them. And as a result, we're taking new perspectives on this, which is enriching, I think, global public health studies. So, as I've said, there's a recognition that the discipline of global public health is far less narrow than we previously thought, uh, far less, uh, far less biomedical and more social sciences orientated. So, as a result, global public health studies um, is now embracing social sciences critical to investigations of global public health. And as a result, it's embracing sociology, anthropology, law, psychology, public policy, and economics and business studies. So as you can see here, social sciences encroaching upon and being integrated into global public health studies. The shift to social sciences is witnessing the emergence of new and challenging themes within global public health to interpret and explain them, as well as developing new policies and interventions in response to these new challenges. So we're seeing significant shifts and new perspectives developing as a result of the integration of social sciences and sociology into global public health studies. So I want to now go on and proceed to look at some of these. And I identify these as, for example, new social science themes and challenges, and we've hinted at some of them. The use of social and sociological theories and perspectives as a result. The shift to social sciences perspectives has also made us look more at health and well-being inequalities and how health, well-being and inequalities are socially created and patterned and not just around physiology, for example, or biology, but that health and illness is actually socially and economically patterned by societies, which gives us a whole new perspective, for example, on global public health. I also think that the role of globalization, but also deglobalization on population and individual health is very important as we shift global public health studies more towards the social sciences. And at the end, I would just like to say a little bit about the development of skills and competencies that will be needed by public health practitioners, for example, as we embrace the social sciences on a much higher level. So let's just look at some of those new themes and challenges which are arising and emerging as social sciences embraces global public health and vice versa. So some of these new themes and challenges are emerging because of this integration as we move away from more traditional biomedical approaches and embrace perspectives which look at how society and individuals create health, illness, and inequalities. So, really big themes which are now starting to emerge is the relationship between health and well-being, loneliness, and social relations. For example, globally, loneliness and social isolation, and its impact on individual and population mental health is a significant and critical challenge for global public health practitioners. As I've mentioned, the role of health inequalities, social inequalities, and healthcare systems is becoming increasingly important. Another big challenge is oral health, dental health practices and systems. And global inequalities in access to dental health, war and violence is becoming an extremely important challenge. For example, the concept of planetary health and how climate change impacts health and well-being, but how society is socially and economically structured, that has a large impact on how different countries are able to, for example, react and respond to global climate change. As you can see, and you can study at your leisure, a number of new themes and challenges there. Social enterprises, different ways of creating healthcare interventions through social enterprise, lesbian, gay and bisexual and transgender health and well-being. You know, gender and sexualities as social determinants is becoming a critical challenge as we move social sciences into global public health. Migrant, refugee and nomadic people's health and well-being. Another very interesting concept is agentic death, dying and palliative care in modern societies, and how death and dying is also structured by societies and social determinants, as well as biology and the biomedical perspective. So just some new themes and challenges for you to think about in what is quite a creative and challenging move into social science perspectives. The other thing as a result we need to look at is the use of social theories and social science theories and perspectives to interpret and cover and explain global public health. As you may know, social theory as a lens, it's a lens to interpret and explain society. It looks at how we articulate and develop relations between individuals and social systems, so social determinants and individuals. So we are trying to explain health, illness, health inequalities with reference to social science theories. And some of the theories being used in order to do this are just listed here. And once again, you can return back to this later and do some more in-depth reading and studying around this. For example, feminism is being used to explain gender inequality in health and illness, critical public health, social suffering theory and social determinants theories. Tend to look at how societies, economic and socially, create health inequalities. So health inequalities is created by society, and that's about empowering different social groups who may experience health inequalities and social inequalities. Social constructionism and phenomenology, how disease, illness, and inequalities are socially constructed through meaning, discourse and language. Structuration theory, which looks at how social structures are socially produced by individuals, but then those social structures which are reproduced go on to give us more rules and resources to construct society. So it's what we call the duality of structure and agency. It's Anthony Giddens's significant theory, which is becoming important within global public health. And then there are other theories which are being used, and you probably know more about this. Health systems theory, urban planning theories and legal theories. So the shift to social sciences is enabling us to use social science theories in order to interpret and explain global public health, health inequalities, well-being, illness and health outcomes. The other big thing that's very important are, as I've mentioned and stressed throughout, our health and well-being inequalities. So for example, this new shift allows us to look at well-being as more holistic than just physical health. How health inequalities and inequities are socially and economically produced and patterned across societies. So, for example, ethnicity and gender, health inequalities in terms of access to healthcare services. And the social science shift also enables us to develop new perspectives on, for example, stigma and marginalisation of certain groups, marginalised groups within society. The social support and networks, for example, needed by these groups. The social support and networks needed to alleviate social isolation and loneliness. How socioeconomic position in society, for example, affects health and well-being inequalities. Even the role of armed conflict and war and violence in generating and prolonging health inequalities is becoming a significant and critical aspect to health and well-being studies. And once again, it's that shift to social sciences which is enabling us to look at many of these issues which we would not really be looking at if we'd adhered to the old biomedical and more traditional global public health global public health type studies. The role of globalization and deglobalization is also becoming very important. You probably know a lot about globalization, greater interdependence and reliance between different countries and the impact of that on global health. However, we're also now starting to talk about deglobalization, or what we might call globalization through equilibrium. Deglobalization, as societies become less reliant or want to become less reliant on each other, perhaps because of war or the global pandemic. This means that countries will become increasingly less reliant and deglobalized, and that has much impact on, for example, on food scarcity, dislocation of food supplies, and growing costs of fuel and energy will impact upon health. The concept of vaccine nationalism, whereby nation states try and develop vaccines as opposed to global cooperation, is a very big example, significant example of deglobalization. And deglobalization will have as much impact upon global health and well-being as globalization and the traditional challenges that globalization poses. So there's just something for you to think about there. Globalization and deglobalization and the impact on health and well-being. And finally, the embrace of social sciences means that we need to develop new skills and competencies for global health practitioners. As we go out as practitioners and global health workers in the global health field. So, you know, new curriculums, new pedagogies, new skills and competencies are going to be needed as a result of this social science shift. So we're going to need more knowledge on the diversity, for example, of health infrastructures and environments which determine the global health environments, but also as healthcare professionals and economists and social scientists, we're also going to need more competencies and knowledges around health equity and ethnic minorities, for example, professional collaboration and networking, the role of ethical reasoning and ethics in designing global health interventions, and more competencies and skills in the design and implementation of public health and well-being interventions as a result of this shift. So, just to conclude, there is a shift towards social science in global public health studies to a more social behavioural approach, and this shift is witnessing the emergence of new and challenging themes, as well as a range of new and exciting perspectives to interpret and explain them and develop policies and interventions in response to global health challenges. So I hope you'll be able to take some of this away with you and look at this in more detail as social scientists, legal theorists and economists. Also, here are some references if you'd like to go into more detail around what I've been talking about. And of course, you're more than welcome to contact me if you'd like more information on this. So thank you very much for listening to this. And I do hope this will allow you to develop your own thinking and learning around social science and global public health. Thank you very much for listening to this.